All right, Mike. So stay with me. I'm just going to upload this onto my Facebook page, and then we'll get started. All right. Mr. Romano, you're there?
I'm here.
Great. Thank you so much for being with us today. This is 10 minutes to the mark. I think we've been trying to coin this. You are the Inspectional Services Director. I know you're very, very and extremely busy, and I appreciate your taking a few minutes out of your day to kind of get us up to speed on what's going on with your perspective on COVID-19. So again, a big thanks to you, and we're looking forward to hearing to what you have to say. And I think the first question I would ask is some folks don't even know what inspectional services is or inspectional service director does, but as it relates to this particular COVID-19 pandemic, what is your role?
So one of the things that a lot of people don't realize is inspectional services encompasses the activities of the Board of Health. So not only do we do sanitary and housing inspections for the Board of Health and food inspections, but we have the city nurse who works under our department. And as a regular course of business, what the city nurse does is she investigates communicable diseases such as COVID-19, things like hepatitis, things like the seasonal flu, TB. And one of her roles is to actively seek out persons who are positive for these communicable diseases and do what we call case tracing. So she gets in touch with these people and she learns where they've been. She learns who's been in close contact with these patients. She orders them to isolate, and then she reaches out to the contacts and orders them to quarantine so that they don't spread communicable diseases around the city.
So I think that if my understanding is correctly, your job goes way beyond the Board of Health, and that's obviously a big part of it. But I know that there recently been a few, whether they're, I'm not sure they're governor executive orders or mayoral executive orders that deal with a lot of different things. But let's start off with the one population that I think you might have some insight is, and that's with the nursing homes, both the people, the healthcare workers that are there, as well as the patients. Can you speak to us a little bit about what's going on there from your perspective?
Sure. So the nursing homes are a vulnerable population, and we obviously have quite a few vulnerable populations in the city. We have rooming houses and shelters, and any area at this point when you have a communicable disease, if you have a location that lives together, they have community space, they share kitchens, they have people who work throughout the building, there's that possibility of spreading a disease like COVID-19. So we've been in touch with the nursing homes. We have 4 of them in the city of Lawrence, right from the onset of the COVID-19 response. The nursing homes are licensed by the Commonwealth of Massachusetts. So they have different rules and regulations, both state and I'm sure some federal guidance. So they've been working with people who license them. They've also been working with the local Board of Health in the sense that we're reaching out to make sure that, to see if they need any help. So if they need any personal protective equipment, if they have any struggles with even staffing, anything that we can do where we can be a voice for those nursing homes, we want to make sure that we're there for them. So if there's any concerns, we would reach out. One of the things we also do is we look for a clustering of cases in the city. So nursing homes in particular, and I won't just speak on behalf of nursing homes in the city of Lawrence, but throughout the Commonwealth, you've probably seen some of the data. We have, the Commonwealth of Massachusetts, I should say, has made it a priority to test both the patients and the staff members in these nursing homes. So I believe it was on March 31st, the governor announced that it was a partnership between the state lab and the National Guard. So one of the things we did is we made a phone call immediately to our nursing homes to make sure that they knew that this program was available. And they did, in fact, end up using the National Guard, bringing them in to do on-site testing. So they wouldn't have to take their residents and bring them to a different location to get testing. So that's been a project that's been ongoing for the past couple of weeks. There's been lots of tests given out to people in nursing homes all over the Commonwealth. And of course, we've seen positive cases and even some deaths throughout the state.
I just want to dig a little bit. I'm not sure to what extent you're able to answer it. So obviously use whatever discretion you need to. I understand there may be some liability issues, whatever, but can you speak to how are the nursing homes in our city been? I mean, you mentioned briefly there's been a few deaths. What has been their biggest need? Have we been addressing their needs? And as it relates to the rest of the Commonwealth, can you give us some perspective as to how we're doing in our city with respect to that vulnerable population?
So I'll speak in a general sense because I don't know that I have the authority to speak and give any specific information for nursing homes in the city of Lawrence. But from what I'm learning, all of the nursing homes in the state have similar issues. And some nursing homes are fine and others have more cases than they'd like to have. So one of the things I'm privileged to be on a conversation with the 14 large cities, the directors of public health. So we have the opportunity to talk about issues like this, like nursing homes. And from what I've learned, there are several clusters of COVID-19 cases throughout nursing homes. One of the common thread, the common concerns that some of the nursing homes have, of course, is how do they isolate patients? So obviously, and this isn't just nursing homes, this is, again, the vulnerable populations that we tend to see a lot of, the rooming houses, the shelters, the group homes. We have a lot of these type of occupancies that share space, and they share that same common problems as nursing homes. Where do you put the residents? And when you have a communicable disease outbreak that not only impacts the city of Lawrence, but also the Commonwealth and other states, surrounding states, the nation, the world, everybody is going through the same set of problems, and there's no real remedy for where to bring people. So space is an issue for a lot of vulnerable populations. The issue that, why it's more of a concern for nursing homes is because they also have staffing. So they need people to take care of them. They need nurses. And as you have essential workers that go out into the city, whether they're a nurse, whether they're a baker, whether they're a convenience store worker, they are susceptible to getting this virus. Some of us have the luxury of staying in our houses and bunkering down, and we're not going to get the virus if we don't go anywhere and we stay in a house. But others have to go out and get to an office, get to an employment. And for that reason, they also have the ability to spread the virus. So one of the troubles that nursing homes have is keeping COVID-19 out of the nursing home when you have staff that are traveling back and forth, and then keeping enough staff healthy and resources available with equipment to make sure that they can care for their residents. So we see this throughout the state. It's a common problem, and many nursing homes are assigned epidemiologists to look at their case, to look at clusters, and the state is very involved also, and of course, local boards of health are also involved in communicating.
So let me we're rapidly running out of time, so I do want to touch one or two more things quickly. The non-essential businesses, and that I think is something that may be falling under your jurisdiction. And if yes, what kind of how are you dealing? Is there a problem? Are non-essential businesses still being open? Are you getting calls on it? How are you addressing these reports? And we're talking about, like, I guess, hair salons or maybe fitness places and a variety of different other kinds of stuff. But can you speak to that a little bit from Lawrence's perspective?
Yeah, sure. So in the city of Lawrence, we tend to look at these essential businesses when we find out that there's a cluster of COVID-19 cases, or we get a general complaint from either an employee who's just concerned, who's nervous. They want to make sure that the right protections are being put into place. So anytime we get a concern from anyone, we visit these locations. What we're not really finding, which is a good thing, there's not too many places that we find that are staying open. In the very beginning, there was a hair salon or a nail salon that was open that didn't get the message. Since then, we haven't seen business fronts open. We have had some complaints about someone who's cutting hair out of their house, but really they're few and far between. I think one of the challenges we have, and it's something that's not really avoidable, is we need some of these businesses to stay open. So there's, again, the grocery stores, even an auto mechanic, whatever it may be, people who make devices to test food, people who bake food. These places have large groups of people, and the challenge we have is making sure that workers do not go to work when they're sick. So you've seen maybe some of the recent guidance. The local board of health has issued a recent order as of last week to make sure that each of these businesses assigns a health and safety officer who will be charged with making sure that all of the governor's orders and all of the precautions are taking place, that people are wearing the proper equipment, that people are maintaining social distancing, and probably the most important thing is making sure that employees do not come to work sick. So we've asked them to have employees take temperatures. We've asked them to have employees self-certify that they're not sick. And right now, if everybody stayed home and the essential workers went to work, it would still be an issue that we have a lot of people that are out there. So we're hoping that this guidance that we recently set forth and this order that we set forth will make an impact and just at least get people thinking about, are you really an essential business? Should you be open? And what can you do to best protect the employees that have to work?
We're running up against the clock, Director. I have one last question. It's a twofold question, really. What is it that is there anything that we need to be aware of? Residents, phone numbers, anything that you need that people can get to you? So what's the messaging, number one, and number two? Do you have a quick story, perhaps, of how this is impacting you? We're all being impacted in some way, but maybe just to kind of keep this real, like we're all facing this. Give us a story, if you don't mind, if you're comfortable with it, about what you're facing it personally.
Sure. So first, for resource-wise, I think it's smart for all residents to look at thecityoflawrence.com, look at mass.gov, call the Mass 211 system if they need information, contact inspectional services by either calling me at 978-620-3140 or send me an email at marmano@cityoflawrence.com. If there's any questions, I can at least get somebody, whatever that question is, I can get an answer or get some guidance. Just personally, of course, it affects all of us. I've spent a lot of hours here in the city of Lawrence. I'm very blessed to have a wife who somehow is able to manage watching our daughter and working a job that's very demanding. My wife is a divisional chief working for the Department of Defense, and somehow she manages to stay on these Zoom meetings and juggle the responsibilities of a 4-year-old. I don't know how she does it, so I'm blessed with that. But all in all, we have a great staff, and our inspectional services staff has really stepped up. I'm so proud of them. Sometimes in moments like this, you really see how great your staff is, how great your colleagues are, from the administration down to every staff member. It's been a great experience. So to leave this on a good note, I'm just proud of everybody in the city of Lawrence and really proud to be part of this team.
Director Romano, thank you so much. Thank you for all that you're doing. Thank your team, your family, for having them sacrifice you a little bit more time than you normally probably would be. But you're not doing this all alone. You got a number of people who are helping you and helping us all out. So thank you so much. And again, thank you very much for being a part of this today. To just say a few words to the people that I represent in District F in the city of Lawrence, and I appreciate your continued determination in trying to battle this thing. Thanks so much.
Thank you.
Have a good day.
You too.